Our webcast is really going to go into our corporate wellness certification program and what it's about and why it's important. We're going to cover what does it cover from a course standpoint, what case studies are involved, what are the benefits of it, how to use the certification to benefit or promote yourself afterwards, and then what are some of the new benefits of the CHWS program, including our new Corporate Wellness Resource Center that we're rolling out. And then what are your options to learn, whether it's at our annual conference or whether it's through our online learning management system. So thanks for coming on our call today. So the Certified Corporate Wellness Specialist program, it's a course that is 13 modules. It says 12 modules here, but it's actually 13 modules. There's continuing education credit available for HR professionals. And you can take the course either online or at our annual conference, the Corporate Wellness Association's annual conference, which this year will be September 20th through the 24th. I'm sure many of you are familiar with the Corporate Health and Wellness Association, but for those who aren't, it's the nonprofit trade association that's made up of employers for employers, all based upon sharing best practices and case studies. It's made up, there's over 100 large employers that are members representing millions of lives, but we reach a very large audience. We reach about 500,000 HR and insurance executives throughout the country through our database and our magazine, the Corporate Wellness magazine. And then we also have a very large presence on LinkedIn. If you're not a member of our LinkedIn group, we have the one LinkedIn group, Corporate Wellness, which I think has about 19,000 members. And then we have a Benefits, Health, and Welfare Professionals group, which has about, I think, 27,000 people, where we discuss a lot of the issues during the year. So for those of you that are not familiar with corporate wellness, or maybe those that are, I always like to share some of these statistics of, how the industry is growing and where it is. Over 50% of employers with at least 50 workers offer a wellness program. 90% of employers with more than 50,000 workers offer a wellness program, and these numbers are actually going to be greater than what they are here because it grows every year. 75% of healthcare dollars go towards preventable conditions, and this is employers, are turning to corporate wellness programs as a way to battle these healthcare costs and these preventable conditions, and knowing it's going to improve employees' health, productivity, presenteeism, and lower their health insurance costs. The corporate wellness industry is really a $6 billion industry. It's probably one of the fastest growing industries in the insurance sector. It's really fascinating to see how fast this industry grew. I used to run a national healthcare administration company, and I was one of the first people to put corporate wellness programs in place back in the mid-2000s when they weren't even called corporate wellness programs. And, back then, no one was really talking about them. No one was doing them. No one thought they had any value. And what we've seen is a total shift in the marketplace where now everything is health and wellness. Almost every employer has it. Most employers are doing it. The people who never mentioned it before are now, it's the main thing that comes out, that are on their lips that they talk about. And all these, even insurance companies that aren't even doing anything wellness related, who are like voluntary benefits carriers selling critical illness or disability policies, now they're adding what they're calling wellness benefits. So they're saying, so everybody's trying to jump on to the wellness bandwagon. But I think that's, it's exciting to see how it grows, but it also means there's a lot of confusion out there. There's a lot of challenges for the industry. There's a lot of confusion over what works and what doesn't and what to implement and who to work with. And so companies now spend an average of about $521 per employee per year on wellness incentives. And, the average medical cost savings per dollar invested ROI in wellness, one study said it was $3.27. Some say it's higher. Some say it's lower. It's really all over the place, and it's very difficult to judge the ROI side. But I think it's very accepted that wellness programs work, and there is ROI. So if we looked at next on some of this chart about the impact of wellness on employees, and I apologize because the slide actually says employers, but it's employees. 62% of employees feel workplace wellness activities are successful. 51% of employees feel it encourages them to work harder. 59% feel they have more energy to be more productive. And 43% say wellness programs lead them to miss fewer days. So I think it's a really powerful statement about the positive impact and the psychological impact that it has on employees. I think it's common sense. You put in something wellness related, you get employees to be more physically fit, to engage in healthy behaviors, to eat right, to do testing and figure out if they've got a health condition. They're going to feel more empowered. They're going to feel happier. So why was the Certified Corporate Wellness Specialist designation created? It was created because our members of our association were tired of subpar wellness programs. Wellness programs that didn't work, vendors that had bad outcomes and results, didn't know what they're doing, no way to measure their wellness program, no way to measure ROI, or they weren't getting a return on investment, or a lack of communication. And so the employers were saying, listen, I remember one of our first meetings in LA back in, I think it was 2009. The director of benefits for Pepsi was, in our audience, and we were having this meeting about, the core focus of what the association should focus on over the next couple of years. And the director of benefits of Pepsi said, we need to get everyone together to start sharing best practices and case studies and what works and what doesn't, because as an employer, we're tired of rolling out a wellness program and finding out it doesn't work, or rolling out a program with a vendor and finding out it's not successful. If other employers would share, hey, don't use this vendor, or use this vendor, or this wellness program works, or this one doesn't work, or if you're going to do this type of wellness program, here are our policies of how we did it in a way that worked. Do this. And by the way, we tried rolling it out like this, and it didn't work. So basically, they all wanted to share. And so that's really the basis of Certified Corporate Wellness Specialist designation. So, where are you getting your best practices in your case study? So I love this picture because really this is old textbooks. No one is sharing new case studies. I saw an employer business group that had like a white paper that came out last year, and they were referencing a case study from an auto manufacturer back in like 2001 or 2002. It was like 10 to 11 years old. So that case study is so outdated, it's so irrelevant, and it's not going to help anyone today. But what's happening is no one is sharing case studies. If there's any kind of association that's got a case study, they purposely do not release it out there to the public, and they have almost none, or they're hanging on and using really old case studies. And so this is a core part of the Corporate Wellness Certification Program, and a core part of what our association is doing is focusing on sharing the most updated case studies. And we do that through our course, whether you're doing it online or at our conference, and in our book. That's our course book, Engaging Wellness, that I'll go into in a little while. So, some of our employers, of our faculty, I know they're not all on this list here, LinkedIn, Hallmark, Racetrack, Petco, Wawa, Dallas-Fort Worth Airport, Cleveland Clinic, Johnson & Johnson, LL Bean. So our whole course is taught based upon employer case studies from employers. So it's not from wellness vendors presenting case studies that are self-promotional or biased. It's not from consultants or insurance agents presenting it. It's from the actual employers who are doing it, and I think that is the most fundamental part of our program and the core of our program about what it's about. It's not theoretical. A lot of the presentations you'll hear on wellness, it's theoretics. It's someone who's a vendor or a service provider, and there's nothing wrong with that, but it could be theory, and it's not going to be as transparent as it is coming from an employer. So to have someone like a Hallmark or an LL Bean go up there and say, listen, this is what we did with incentives in 2013, and this is what didn't work, and this is how we've changed them in 2014. And this is what we did with weight loss and smoking, and this is what didn't work, and now this is what we're working on, and this is our ROI that we're getting. So that's what the whole course is really built on. And okay. So the program was created for employers by employers, as I said, real-life case studies, not theories, and best practices. So I'm going to skip through some of these slides. Our program was built for both large and small companies and mid-sized companies. So it's really a program where you can learn about anything depending on the budget or the size of your employer. We also do group live training of the program, which can be live webcasts that are in your offices or online. And I'm going to go through some of the core competencies of the course, and this is kind of what I'm going to go into what the actual modules are that you learn, but the core competencies that you're supposed to walk away with the course is obtaining management support, creating and maintaining wellness committees, program design, budgets, incentives, health risk assessments, biometrics, environment and benefits, legal issues, return on investments, the Affordable Care Act. So some of our modules in the course, Corporate Wellness 101, Beyond Zero Trends, Pearls of Wisdom, making sure senior leadership actually walks the talk, meaning make sure the C-suite's participating in the wellness program. They've bought into it, but they're actually participating in it. One size doesn't fit all, understanding the unique needs of your employee population. That's a case study from Racetrack Petroleum. It's so important. It's making sure that if you have a wellness program that it's built to your specific culture. If you've got a manufacturing company in North Carolina, those people might not have computers and they just have cell phones. So you certainly aren't going to be able to roll out a gaming platform that you need a computer for or a smartphone because it might not meet that population. So it's all about creating a custom program based upon the culture of your company. There's one session, how Hallmark and Petco have navigated wellness communication to achieve maximum employee engagement. Another one, the only proven solution to rising healthcare costs, creating cultures of health. Work affects health or health affects work, why businesses must consider both. The 8th module, employee health and wellness results from an incentivized and outcomes-based integrated system. How LL Bean is tracking outcomes, overcoming their ROI struggle, turning the incentive debate upside down, driving behavior change without a carrot or stick. The Affordable Care Act's expansion and endorsement of wellness program incentives. The 13th module, super important, wellness works, but beware of the landmines, the legal landmines. So, we have done webcasts where we've done surveys and said, hey, if you ran a specific wellness program this way, does it comply with the law or not, and which law does it comply with or not comply with? And you'd be surprised where we'll get literally in some of those questions, 70 to 75% of the people, even people running wellness programs for a while, that get that question wrong because there's some nuance with their program that they're doing. All of a sudden, you're violating one aspect of one of the many laws that actually apply to corporate wellness programs. And so that legal thing is, obviously the legal thing, the legal side of it, and it's not really exciting. It's not a sexy topic. It actually becomes stressful because, you're trying to do good by your employees, and all of a sudden understanding how you've got to navigate legal landmines, and if you're running a mudding program, how you might have to give something alternative to someone who can't participate in it. All these things are really important, and that's all done through examples and case studies of situations. And it really, I think it's good because it gets your mind to start thinking about, hey, now certain things that I do, does it comply or not comply? And I think it'll really help you, not run into any problems. Another one, creating the culture of health with game-based social health communities, and that's a Safeway case study. Practical wellness programs, planning tools, workshops, it's applications for success. It's a 2-part program. Wellness for your traveling, telecommuting, or remote workforce. So that's the core content. We also have CEs, which are new case studies and other topics that are added to the program all the time. And so when you get certified, your designation doesn't stop there. You actually continue on with the CE. So you take the course. When you're done, you take an exam to make sure that you know the knowledge. It's a 100-question exam. Once you pass the exam, you get your diploma. You get, the frame that gets put on the wall. You get your seal that you can put on your business card. You get to use the Certified Corporate Wellness Specialist designation. But then you're required every year to go through 5 hours of continuing education, and that's specifically there so that you're staying on top of the current case studies. Because if you're certified, that seal means you're a top leader in the industry, and we don't want people having that designation in steel who aren't staying on top of current trends and updates and things that now are working that weren't being done before. We also have Engaging Wellness, our corporate wellness programs book, and It is $80. It is comprehensive. It took us 2 years to complete. It's about 600 pages with about 50 top authors in the industry. It was second edition, came out in November of 2013, just a couple months ago. And you can also get it as an ebook for $35. And there's about 16 chapters and about 20 employer case studies in there. And it includes program design, incentives, HRAs, biometrics, dealing with the C-suite, on-site clinics, creating a culture of health, measuring program success, the Affordable Care Act best practices, using social media for wellness, multinational wellness from multinational companies, program communication and employee engagement, small group wellness programs, and fully insured versus self-funded, and other essential information. It's a lot. It's very comprehensive, but it's really great, the insight that you'll get from it. So one of the things that I say is, why wait? How do you differentiate yourself from other wellness experts? So wellness is now, the hot new thing, meaning that it's what everybody wants to get into, because we know healthcare costs are going up. The Affordable Care Act is not lower costs, it increased costs. And employers are really, they're in a financial crunch, and the costs are only going to go up year after year. So more employers are going to turn to wellness to really try to have a meaningful impact. That they've tried everything else, consumer-driven plans, high-deductible plans, they don't work. And so they're turning to wellness. So as they come in, how do you show that you're different and have more knowledge or are truly an expert versus everyone else who says that they're a wellness expert? And what about not just now, but in 2015 as the mandates, the employer mandates kick in for the Affordable Care Act, and now employers are getting fined or offering coverage, you're going to have more people entering the wellness sector and saying they're wellness experts. So how do you show yourself to be different than everyone else out there? And that is through a designation. And, handing a business card, whether you're an agent, broker, consultant, or if you're an employer and, whether you're trying to get a raise, a promotion, or going for a new job, you need to make that first impression in a way that they're going to remember you, that you have a special set of knowledge and you're committed to the industry and continuing education and staying on top of best practices and trends. And this is how you stay out. This is how you stay ahead of everyone else. I'm a big believer in advanced education. This is an example of putting the seal on your business card. I also advise. I'm very big and active on LinkedIn. I think I'd already mentioned we run about 40 groups with about 300,000 members on LinkedIn. And LinkedIn is the most powerful tool for people to really connect and find each other and help each other out, collaborate, do business, get new jobs, new connections. Is you go ahead once you get it and put it as your current position. So then, without people even having to click on your profile, they'll see that Certified Corporate Wellness Specialist designation. And then they're going to know that this is your specialty. And so then you can become a resource to people where they would want to reach out to you for things versus burying it further down in your profile in a way that they have to click on you to find out that information. And then also, if people are searching on LinkedIn for someone who's an expert in corporate wellness, your profile will come up. So our Corporate Wellness magazine, it's the only dedicated magazine in the industry to corporate wellness. We have over 100,000 readers, and we promote people who have been certified through the magazine. So you can actually go on there, look at who's certified, search by city, by state, and then send a message directly to those people. And that's our way of trying to help our certified students really grow. I already mentioned, but I definitely recommend you guys join our Corporate Wellness LinkedIn group. It's about 19,000 members, and we add about 1,000 people every 2 weeks, and this is where you can really share ideas, collaborate, and connect with people. As I was saying earlier, this is an example of the diploma you'll get once you become certified. There's two different certification options you can have. It's a certification, it's $9.95. But we also have a recently new launched program, which is $11.95 for that includes a job guarantee. And I'll go into that in a second. But really, what we're trying to do is trying to help place people in positions. We've got a lot of feedback of people wanting assistance getting placed with employers or someone who was in wellness, and they either left their position or they might have been laid off, and helping them get placed with another employer. So because if we reach 500,000 HR and insurance professionals and executives through our database, through our magazine, through LinkedIn, Facebook, and otherwise, we realize that we can really have a big impact. So when you get certified with the certain option on with the job guarantee, There's information on the website, and and that explains how it works. But really, it's us going out and trying to see if we can place you in a full-time position that's paid, a part-time position that's paid, or placing you in an internship that could be paid or unpaid, and then obviously that internship could turn into a full-time position. Because it's very difficult right now, if you're an employer, where do you go to look for people who are qualified in wellness? It's a very limited pool. It's not something you can just post on Monster. So this is something the association is going to really focus on and help with. One of the new benefits when you get certified, really excited about it, is going back, it's called the Corporate Wellness Resource Center, and going back into the beginning of the presentation of why the association was founded and why the certification was founded, about employers sharing best practices, case studies, other things. Our online Corporate Wellness Resource Center is going to have all this. And if you're going to be able to go online, you're going to be able to pull up wellness white papers, webcasts, research, policies, practices from other employers, case studies, anything that you would want regarding wellness. And we're going to start having employers starting to contribute and say, hey, this is how we do gaming in our company. Here's all the policies and practices that you could put in your resource center. Here's how we do gaming. So it's going to, we got a couple hundred resources in there now, but we're hoping to add up to 1,000 by the end of the year. So this is your one place where you can come to everything. And this is because, and employers may not have the budget to go out and develop a whole new initiative on their own. We're all busy. We're dealing with personal issues, business life, healthcare reform. So if an employer wants to implement gaming, if they want to implement a mudding contest, rather than starting from scratch, they can pull from the resource center. So we spent about several years building that resource center and building some of the content that's going to go on there. And if you'd like to contribute or on the call, you got a case study, a policy or practice you'd like to share, please let us know. We'd love to include that. And once you get certified on our store, you can go and get your little, your CHWS jacket, your mug, your pin, all those things that you can wear. Now, you can also get certified. We have our online platform. It's built for the busy professional. You can learn, at your own pace and watch the modules, video, and the PowerPoint there. But you can also get certified at our annual conference. It's the Corporate Wellness Conference. It's September 21st to the 24th in Washington, D.C. We're going to have about 200 speakers, over 20 case studies just from employers. We get up to 14 SPHR credits for HR and 20 hours for agents. And we're doing a lot of neat things that I wanted to share with you. One of them is we have an interactive exhibit hall if you haven't been there before. So we had a wellness market last year where there was, you could see the latest in gaming and wellness. You could go ahead and, we had little bikes you could bicycle to power healthy milkshakes. There was a lot of interactivity, but we're taking that to the whole next level this year. So at the bottom of the screen is where you have your main entrance. And then you come in, you'll see there's the wellness market. It almost looks green with some trees. And that's going to have all kinds of wellness, and then we're going to have a wellness pavilion that's going to be like the office of the future, where we're going to have, hey, this is an on-site gym at the workplace. Here's a sample of an on-site office with the walking treadmills and where you can sit and bike and type, and ergonomically correct furniture. So we're trying to really build an interactive pavilion. We're going to have what's new in wearable technology. For fitness, and then we're going to have a consumer mHealth hub. So if all of you aren't aware, there's this huge movement, and in the next 1 to 2 years, it's going to be in every plan, moving to mHealth and mobile health solutions for employees to wear or take home with them. So if you got diabetes, you got a heart problem and stuff, you're going to get within your plan something that's going to help you monitor it all the time so you stay healthy and you don't have to go to the emergency room or go for an immediate surgery, because you're going to be able to monitor it on an ongoing basis, and this will be incorporated within the wellness programs. So Cigna partner with Samsung, and there's a lot of movement on the mHealth space, and it's going to be, mHealth is going to be a big way in how to engage consumers in the plan. We're also going to put the general session in the exhibit hall. I'll go to the back. You'll see in the back there a little blue chart. That's going to be the exhibition. And then in the back right is the networking area where you can schedule one-on-one networking meetings through our networking software. You get to see who's coming and schedule meetings. And then we have a power session in the exhibit hall where we're going to have really short power sessions. So this is I believe I was about to say this is some of the speakers within our corporate wellness certification program, but I think these are speakers from our corporate wellness conference. We bring in all the national speakers. We bring in, we've had Google presents, who is not, allowed to be filmed or watched, but they come and present at our conference to really share everything that they're doing, cutting edge. Verizon, Zappos, Sprint, Hallmark, McDonald's, Kraft Foods, Coca-Cola, Amex, Dell, Walmart, Intel, Boar's Head, Cisco, NASA. So we bring in all the top employers really showing what's going on that's cutting edge in corporate wellness programs. This year, these are just some of our speakers. We got Alan Jashinsky. He's in charge for the IRS of all the fines and compliance with the Affordable Care Act. Really great input to find out what's happening with wellness and wellness incentives. The president of the AMA, I'm really excited to say that Health and Human Services, the HHS, is going to be coming and presenting on WellStrive. It's the U.S. government's corporate wellness program that's being rolled out to over 1 million federal employees, and I think in over it's like 140 federal agencies. It's President Obama and Kathleen Sebelius. It's their personal project and wellness program. So they're going to explain what the federal government's doing in wellness. The president of the American Hotel and Lodging Association, the president of the American Benefits Council. Michael's going to be joining us again from LinkedIn, MGM Resorts, Chipotle, Mexican Grill, which I love because we all have, organic chicken and pork and things like that. So I love Chipotle restaurant. I love eating there. I love having antibiotic-free chicken. And we have HP, University of Alabama, CKE Restaurants, which is a big restaurant chain, Crowley Maritime. So we bring in a lot of the big employers. It's a packed session, and you can jump into the tracks you want. There's a lot of private roundtables and forums if you come that you should really participate in. We have the Healthy Foods in the Workplace Forum. That started out a couple of years ago with 10 employers sitting around a table, and now it's 80 employers sitting in a room talking about what they're doing with healthy foods in the workplace and nutrition and getting people to be healthier and cutting back on obesity and other conditions, and how employers can lead that charge. And it's one of the most successful parts of our conference. So there's all these private roundtables and forums that they're invite only. So if you're an employer, you can request to participate. And then one thing I don't think it's in this webcast, if you're an employer, you can also apply for a complimentary free pass to the conference if you just go on to our website where you can apply for that free pass. We also have added the National Fitness and Nutrition Conference this year, which is its own event and track during the conference. So one of the big pieces of feedback that we got was employers wanting to know what they should focus on in the area of fitness and nutrition and getting their employees really active. And so we rolled that out this year, and we're going to have 10 sessions just on fitness and nutrition, and we're also going to launch at the conference a fitness and nutrition certification. So you can come attend the conference and become a certified corporate fitness professional or a certified corporate nutrition professional. And we're going to focus on a lot of education in this area this year, because what we want to do is create a grassroots movement of people who can really come into the employer marketplace and on a grassroots level get the employees engaged in fitness and nutrition. And I think that's really important. With that, like I said, you can get certified online or at our conference. If you were on our webcast today, you can save 15% off of our certification. And I know that one thing that was cut off from this PowerPoint, I think it was when it was changed, is we're also offering the Engaging Wellness book complimentary for people who are on the webcast. So it's an $80 value plus the 15% off. All you have to do is use the code CWC15, and that'll expire at the end of this week. CWC, I'm guessing, is short for Corporate Wellness Certification, or it could be Corporate Wellness Conference. So CWC15 at corporatewellnesscertification.com. And if any of you have questions, you can ask questions in the Q&A box. You can email us afterwards. You can email me at John, J-O-N, at wellnessassociation.com, or any of us here at info@wellnessassociation.com. Our phone number also is 561-204-3676. One question came in from Brad that said, should I get certified now and then come to the conference, or should I wait till the conference to get certified? Either option, works. I would suggest if you actually get certified now prior to the conference, I think you're going to be able to really, get more out of the program, because if you're coming to really connect with new ideas and network with people, the fact that you're going to have already gone through the course and have that knowledge and expertise, I think that's going to give you a pretty big advantage. Another question Michael said is, does the corporate wellness training offer CE credit for insurance professionals, and in what state? So it doesn't right now. It does at the conference, but if you were going to do a group training for people in your office, we could put together a group training that includes CE if it's more than a couple people. It's very easy for us to do, because we do continuing education in all 50 states in a bunch of different areas in wellness and in healthcare reform. So another question that came in was, if you don't have the money right now, can you, is there any kind of a monthly payment plan that's available to become certified? And the answer with that is, that's a great question, Kristen, is yes. We did put together a finance program with Pay Me Later, which is a PayPal company, where you can go online and apply to them, and then they'll finance your your certification over. It could be 6 months or a year, and then you can pay them directly. And I think they even have a policy where if you pay it off at a certain amount of time, there's no interest. So you can definitely do that, and you'll see that option when you go to our website. Barb asked a great question. I attended the conference last November in Vegas. I hope you had a good time, Barb, and hope to see you in D.C. And she said, I paid for the certification exam, but I haven't taken that exam just yet. Am I still able to use the exam? So there is a period of time where you have to take that exam, but just reach out to us. You can reach out to Kristen Carter or Sarah Hunt in our organization. We'd be happy. If that's expired within your the learning management system, we'd be happy just to go on there and renew it to give you a chance to take the exam. We know what it's like to be busy. Another question that came in from Frank, it says, what can you charge a company with 50 employees for a custom wellness program? I think that's really an open-ended question. If you want to reach out to me afterwards, I can really go into that. But there's a lot of issues, and so as in what type of wellness program. When you say custom, I mean there's really, there's small basic programs. There's just things you can do electronically, and there's full-blown programs. But there are solutions for a company with 50 employees. I think a lot of wellness programs have left out the small group and the mid-sized group, but I know we're having a much larger focus on that and really trying to encourage more of those type of programs for small and mid-sized employers. So with that, if anyone has any questions, please feel free to reach out to me. I'd be happy to follow up with any of your questions. So you can, as I said, email us at info@wellnessassociation. Call us at 561-204-3676. Our certification site is corporatewellnesscertification.com, and the Corporate Wellness Conference website is corporatewellnessconference.com. So I want to thank everyone for coming on the call, and I hope everyone has a great week. Everyone had a happy Easter, and take care. Bye.